I'm Dr. Michael Freeman, the Chairman of the Department of Surgery at the University of Tennessee Medical Center, and I'd like to invite you to learn more about us here in the Department of Surgery as you go about trying to make a choice of where you're going to spend the next 5 years in your surgical residency. I feel that we have one of the best surgery training programs in the United States. We have a dedicated faculty that's going to teach you all about surgery and the pathophysiology of patients.
I think we have just the right amount of residents for the amount of faculty that are present. That enables us to have a large case volume and a lot of one-on-one learning.
We've graduated from 4 to 6 residents and have expanded our program now to over 60 faculty and have gone from just a couple of surgical teams to almost a dozen areas of exposure for our residents.
Very unique thing I liked about UT Medical Center and our program, doing an international rotation my 3rd year in Kenya, and it was probably one of the best experiences I've ever had.
Interviewing throughout different residency programs, it was extremely apparent as soon as I came here to our resident dinner that the residents were so friendly and it was a lot of camaraderie. It wasn't joining a residency program here, it was joining a family.
Our faculty do a lot of mentoring on a daily basis. A lot of people think of that mentoring as just in the operating room, but it extends far outside of that. And so having a relationship in which residents can talk to their faculty about job opportunities, how to get ready for the next step in life is very important, and we work diligently on that.
We operate a lot and very early. We have quite a bit of autonomy in our patient care as well as our operative training. We're always busy, which is a good thing. Being a general surgery resident, you want to have exposure to things as much as possible because you may only see it once or twice and you need to have some experience, especially when going out into practice later on.
Hello. We have a lot of conferences. So we take Tuesday morning as our dedicated conference for the residents. There's trauma conference every day, which they do checkouts and really learn about surgery. And then they have several hours of dedicated didactics. And then we have grand rounds and then subspecialty conferences throughout the week.
My primary professional goal is to be a rural general surgeon, practicing at the full scope of my training by the end of 5 years. The University of Tennessee Medical Center's general surgery program, I knew that with case volumes for graduating residents in the 90th percentile, with an extremely large rural catchment area, rotations at community hospitals, I knew that I'd be well prepared to satisfy that goal and to practice confidently upon graduation.
UT Lifestar, which is our helicopter service, is a total of 5 different helicopters.
I think when many people hear about UT Lifestar and us being a level 1 trauma center, they think of those trauma cases and the complexity of them. But what people forget to think about is how UT Lifestar brings surgical cases of all types, whether they're cancer cases or complex surgical cases, from the community here to Knoxville. That provides an excellent opportunity for our residents and trainees to see some of the hardest and most difficult cases and prepare them for their end career.
The Robotic Experience at the University of Tennessee Medical Center is great. There are 4 robots on the main campus and 1 in day surgery, and they're very easily accessible for residents and staff, and it really enhances our learning here.
I had the opportunity to work on the Da Vinci robots as a medical student. We utilize the robot as much as possible. It's safer and more efficient for patient care. We are definitely given the opportunity to be on the robot from very early on in our training.
I think it's important to have a work-life balance, and one of the things I like is that we have a night call system here so that you do your month of nights and then it's done and you're not taking home call every 3rd day or every 4th day.
Knoxville is an outdoor activity mecca, from hiking, kayaking, boating, mountain biking, or simply just eating on an outdoor patio. You name it, Knoxville has it.
UT Medical Center is an excellent balance of academic work and clinical work. I wanted to go to a program where I started operating on day 1, and this is absolutely a place where you can do that.
If you come to University of Tennessee, you're going to know how to operate. You're going to know how to take care of patients, and that's what it's all about. So I think that this institution can offer a lot to those individuals for great training, whether it's entering private practice in general surgery, will get you where you need to be.